I'm Joanne Jones and I manage the nutrition and dietetic services in Central London Community Healthcare, of which we deliver services in Kensington and Chelsea, Westminster and Hammersmith and Fulham. Malnutrition is a significant issue for the NHS and costs billions of pounds a year. Within Kensington and Chelsea, we've been working to address malnutrition from both the prevention angle and also the clinical treatment angle.
So Liz, last time you were here, we talked about swapping those supplements for some drinks.
My name's Maureen Morbeck. I'm the Nutrition Support Specialist Dietitian here at Central London Community Healthcare in Kensington and Chelsea. We work with adults, in particular older people over 65. We do see a lot of people with low BMIs, body mass indexes, which show that they're underweight. And we also work with people that are on prescribable supplements, so really working with them to rehabilitate them back into normal eating patterns and stop them relying on supplements so much.
Okay Liz, I'm just going to show you how to make one of those drinks that I've been talking about, and that way you can do it at home yourself. As a dietitian, we can't see everyone, so we do rely quite a bit on other healthcare professionals to help identify people that might be at risk. So we do work with district nurses who do identify people within the community who probably may be a bit more at risk because they are housebound. We also work with GPs who do see all their patients, so they're also identifying patients at risk. We work with acute dietitians within the hospital, so anyone that they're discharging on supplements will get referred to us so that we can then follow them up in the community. So Liz, do you think you'd be able to do this yourself at home?
In terms of career progression for dietitians, we start at new graduate level, and traditionally new graduates moved into the hospital setting. However, we're finding more and more now that there's new graduates positions available within the community setting. We've also found within our service that we've had nutritionists at a lower grade come into our service, and after a year or so working as part of the wider team, they leave and go and study dietetics, having had that exposure of working in the public health functions. We also have the ability to move staff throughout our grading and career structure and to gain exposure in different settings, and that's one of the benefits of us of having both the public health and the clinical team. Staff have both the exposure and the opportunity to develop skills in those environments. The role of the dietitian has developed, certainly within Kensington and Chelsea in recent years, to really put an equal emphasis on the skills required to deliver a public health approach to nutrition. And that's very much working in partnership with non-traditional stakeholders, if you like, so our local authorities, our voluntary sector, our third sector, to look at how we engage with service users, how we put policies and processes in place to make sustainable interventions in a range of settings.
Tony, I just wanted to take about half an hour of your time this afternoon just to talk to you about the Food and Nutrition Action Plan that we've developed for the Kensington Day Centre. My name is Jessica Taylor. I'm a public health dietitian specifically working with older people within Kensington and Chelsea. We do a lot of work with the local authority, so specifically the adult social care sector. We also work within day centres such as this one, Kensington Day Centre. We also work with community groups, volunteer organisations, but crucial to all the work we do is we work very closely with the service users, so the older people themselves are consulted within each of the services that we deliver.
It's very important for your health and your nerves and your bones, especially to keep your nerves good and your brain working. They say you must have good food.
It's important for your health. I think it stimulates the brain as well.
Preventing malnutrition within the community not only allows older people to experience a higher quality of life and be more actively engaged in services, but it also helps to reduce the burden within other clinical services as well.
I think it's really important because it's a matter of prevention for us, and that's the reason why we got involved with the dietetic service, so members can be more aware of what dietary matters to take, and so they can take them independently themselves as well as here.
There's a strong emphasis now on working in partnership with other healthcare professionals. We have our teams working in multidisciplinary rehabilitation teams. We work very closely with our district nursing services around malnutrition screening and identification, and more recently we've worked quite closely with our podiatry colleagues to implement a pilot project around their services screening for malnutrition, and then our services picking up patients at high risk. We've worked with our GPs over the last 2 years to ensure we have appropriate prescribing of oral nutrition supplements within the community. The results of that indicate a 12% reduction in the prescribing costs of these products within our borough.
It's really satisfying to see someone get better, to see someone achieve their goals, to gain weight, to be able to go out of the house because they're feeling stronger. So it's a really satisfying job.